I'm pleased to welcome Nikki and Elliot, but I will let them introduce themselves, and they will take us through the learning this morning from the two statutory reviews, the domestic abuse related death and the safeguarding adults review for Rosa. If I could ask people to remain on mute during the session, and any questions, if you could post those in the chat if you're able, and we will hopefully have some time at the end and we'll come to those at the end. So I'll hand over to you now. Thank you.
Good morning, everybody. I'll start by introducing myself. My name is Nikki Norman. I was the independent chair overseeing the domestic abuse related death review into the death of Rosa. Actually, we could nip on to the next slide, Elliot, just to have that, shall we? My background is very much in the domestic abuse sector for over 35 years, both at a local and a national level. I worked for 14 years at National Women's Aid, but I've also for several years been an independent charity consultant and chair for domestic homicide reviews or domestic abuse related death reviews. But before I hand you over to Elliot, just a reminder that we're here because of the death of Rosa, who sadly lost her life in August 2023, and you know, just to remember that Rosa has really missed a great deal by those who knew and loved her. So over to you, Elliot.
Thank you, Nikki. So I'm Elliot Smith. I'm an independent reviewer for Safeguarding Adult Reviews. My background is in safeguarding primarily. I was a mental health social worker in a local authority, urban unitary local authority, and then a large NHS trust in a strategic role for safeguarding. So I'm currently doing safeguarding adult reviews independently, and I've just...
I had a few meetings.
Oh.
And they were really happy.
Oh, someone unmuted. So I've been doing safeguarding adult reviews for about the last 10 years. Did my first review in 2016. So that's me. For today, here's the format of the event. So we've prepared some content. You've had the opportunity, hopefully, or will have to go through the reports and to read those for yourselves. So we're not going to present in great detail recommendations, findings, learning, the kind of minutiae of the reports. What we're going to do is give you a real overview of who Rosa was herself, a little bit about her, some of her experiences, why we had statutory reviews, the SAR and the domestic abuse related death review. We're going to talk very briefly about how those reviews look, how we conducted those reviews, because there were some slight differences. And then we're going to really focus in on the experiences of domestic abuse and how those relate both to domestic abuse systems, but also safeguarding systems, and touch on some of the key areas that we can see across Rosa's experience, whether we're coming from it from the domestic abuse or the safeguarding perspectives. And we're going to talk about some of the learning in a real thematic sense, and then we've got space for Q&A at the end. And due to the numbers of people, and also so that we're able to give a considered response to questions. If you have questions while we're presenting, then put those in the chat and we'll keep an eye on those and address those at the end. So we'll move on to talk about Rosa herself. And what I've done is I'm just relying really on some of the reflections and contributions we had from the family of Rosa. And I'll put the quotes up and we'll just consider those. So Rosa is described as an honest person. She wore her emotions on her sleeve. When she was asked a direct question, she gave a direct answer. When she was vexed, you would know about it. But she was kind, She was gentle, caring, and sentimental. She may not have always seen things the way that we do. This is from the family, but we know she often felt things deeply. She couldn't always articulate what she wanted, but she was able to get our attention the easy way or the hard way. People who knew her, that the family spoke to, all commented on her love of children, how good she was with them, how much they loved her, and also her huge, clear blue eyes and brilliant smile.
I'll pick up this one. So her family said, "We want Rosa to be remembered as a person. She was loved by her family. She mattered. Her life had value. She was more than a safeguarding concern or a collection of professional records. She was a daughter, a niece, a family member, and a person who deserved to live safely with dignity, respect, and the right support." So I think all of those just really nicely kind of frame that we are talking about a very real person who was really valued by those who knew and loved her today. So I'm just going to give some top line kind of information again about who Rosa and Brian were. Brian was Rosa's husband. Rosa was a 32-year-old white British woman. She had learning difficulties, but the level of learning difficulties that she had was really unclear. At different times, professionals stated that her disability was mild, moderate, or severe. Her aunt, who obviously knew her really, really well, said that her mental age was around that of an 8-year-old. In May 2016, approximately a year after presenting with symptoms, Rosa was diagnosed with relapsing or remitting multiple sclerosis, so MS. She became a wheelchair user later following her diagnosis, and has her mobility deteriorated. And she died in hospital in 2023 from complications arising from her MS. And again, there's a quote there from her aunt who, again, that just kind of places her very much at the centre of this as a person. Brian was a 46-year-old white British male. He had 3 children from 2 previous relationships, all of whom were removed from their parents' care due to safeguarding concerns. Brian's previous partners all had some level of learning difficulties, and domestic abuse featured within all of those relationships. And just to give you a flavour of that, this included, with one partner, stalking and harassment behaviours and breaches of a non-molestation order. With another partner, reported assaults, theft of money, and a sexual assault. Another partner came into contact with police, social care, and the MARAC as a vulnerable adult with mental health concerns and learning difficulties. And due to allegations of sexual assaults, financial abuse, and physical abuse from Brian. And in 2013, another girlfriend reported that he had raped her. She later said she'd made the allegation up and received a caution for wasting police time because she'd gone back to live with Brian at that point. But no further information about this relationship was available. In 2006, a boy reported that Brian had sexually abused him, and charges were actually put to the CPS, but no further action was made by them due to there being insufficient credible evidence. But Rose's family also reported Brian, preventing Brian from being in contact with children in their family, following an incident of what they call sexually inappropriate behaviour towards a primary age school boy. And so they believed that he posed a risk to young children early in Rosa's and Brian's relationship. And also prior to his relationship to Rosa, Brian was sentenced to a 12-month community order and banned from keeping animals for 5 years for causing, permitting, or failing to prevent unnecessary suffering to 2 dogs and a cat. Over to you, Elliot.
So I'm a social worker by trade, so I go back to my roots with a genogram. This is representation of Rosa and her family networks. Rosa's here at the centre. And the reason we present this here, it demonstrates the level of family and support she may have had around her. But actually what we saw is abuse not only from Brian, but that also Brian had a nephew that lived within the household with them. There were allegations of coercion and control towards the nephew, who we're calling Todd, and from Todd towards Rosa. And I guess at this point it's worth clarifying that these are all pseudonyms. These are not the real names of the individuals involved. And that's standard within statutory reviews. So we've made up names for them, or they've been chosen. I think Nikki worked with family to choose the names that we're using here. This household very much became Rosa's life. Other members of family, her aunt, her grandmother, who she was close with, even her uncles, were all subject to coercion, control, or abuse from Brian, and were all over time cut off from Rosa. So Rosa ended up very isolated, relying on Brian and Todd, not only in the household, not only in an emotional sense, but in a very practical sense as well. As her mobility deteriorated, as she needed care and support, she relied more and more on Brian and Todd, and she had less and less contact and ability to see her family. And this is the context in which we kind of join the review through chronologies and information about her experiences as services in the system. So I think we're back to Nikki.
Thank you. So just to give some kind of a little bit more detail to the background, Rosa and Brian had been in a relationship since 2013 when they met in the local Pentecostal church. They married in 2014, and Rosa gave birth to twins in the same year. The twins were removed from their care due to safeguarding concerns about Brian and Rosa and placed in foster care. And contact between the twins and the parents did take place between July 2014 and January 2015, but then the twins were placed for adoption. Rosa and Brian lived with Rosa's grandmother and Rosa's uncle until July 2022, when they moved into their own tenancy. And this move was prompted by Rosa's aunt, who was raising concerns with housing about the untenable situation in the home and the impact on Rosa's grandmother and the uncle, etc., with Brian and Todd as well, living there at that time. So Brian's nephew Todd did live with them from quite early on and continued to live with them up until Rosa's death. And Todd and Rosa's uncle also had learning difficulties. So the referral for the Domestic Abuse Related Death Review, or DARDR, as I might call it from here on, came from the medical examiner's office, who questioned whether Rosa's death might have been preventable in September 2023. So now we're just going to look a bit about how this became a statutory review. So initially looking at the circumstances of Rosa's death. On the 6th of June 2023, following quite a period of increasing concerns for Rosa's deteriorating health and well-being, the MS nurse and a colleague visited Rosa. She was found to be really unkempt, her nails were dirty, her hair was matted, she had dirty skin between her fingers, and her lips looked dry and dehydrated, and she had what they thought was thrush on her tongue. And also her speech was slurred and with left side weakness to her face. So quite a concerning situation they came upon. Rosa was also complaining of difficulty in swallowing. She wasn't eating. She had abdominal pain and was voiding into her pad. On her pad, there was evidence of old blood, dehydrated urine, and a small amount of fresh blood visible when her pad was changed as well. So the same day, the GP and the MS nurse discussed Rosa's acute deterioration, and an ambulance was arranged to take her to A&E. Once she was admitted to hospital, Rosa expressed the wish to go home, and Brian tried to insist on several occasions that he was going to take her home. So several mental capacity assessments were undertaken, and Rosa was deemed not to have capacity to make the decision to leave the hospital. So deprivation of liberty safeguard, or DOLS, were put in place to safeguard her. And on the right there, I think you can just get a flavour of the kind of the professionals that were involved with Rosa just while she was in hospital, in addition to the ward doctors and the nurses. She interacted with police, adult social care, physiotherapy and IMCA, occupational therapy, the learning disability team, psychiatric liaison team, and the MS nurse, who was consistent throughout all of this. So while she was there, safeguarding referrals were made, best interest and safeguarding strategy meetings were held, and various kind of attempts for professionals to come together to work out what to do because of the concerns, safeguarding concerns about Rosa. Apologies, it's missing a bit.
Nikki, you're on mute, I think.
Oh gosh, how did that happen? That's odd. So in August 2023, Rosa, after being in hospital for 2 months, she became acutely unwell and was found to have pneumonia. And she was reviewed by the intensive care unit, who felt that she wasn't suitable for invasive ventilation due to her underlying frailty and the severe MS. And then sadly, on a later date in August, she died in hospital, and the cause of death was recorded as aspiration pneumonia and multiple sclerosis. So next slide. So the review was undertaken within the framework of a domestic homicide review and guided by the associated 2016 statutory guidance. There is a name change in process, although it hasn't legally gone through yet. The name of domestic homicide reviews is being changed to domestic abuse related death reviews, and the reason for this is in recognition that not all domestic abuse related deaths are homicides. And the statutory guidance says that they should be carried out in these circumstances. So when a person aged 16 or over appears to have resulted from the death of a person, appears to have resulted from violence, neglect or abuse by a relative, spouse, partner, ex-partner or member of the same household. So in Rosa's case, the concern that abuse and neglect may have been a factor in her death prompted the DARDR. And while recognising that Rosa did have extensive care and support needs, that it was really important that the DARDR just focused as much as possible on the domestic abuse and avoided commenting on the effectiveness of health and social care responses. Over to you.
So often in complex cases, or where family dynamics and domestic abuse is a factor, there are also concerns around care and support. So Safeguarding Adult Review is another statutory review, this time under the Care Act 2014, where the Safeguarding Adults Board must arrange a review when an adult dies in its area as a result of abuse or neglect, whether known or suspected, and where there are concerns about how agencies worked together to safeguard a person. So the aim of Safeguarding Adult reviews are to learn from those individual circumstances, those individual experiences, and then look more broadly at the system to produce findings and recommendations. We have a real opportunity here with 2 reviews to complement each other, to focus on the system in a real broad sense. And what we have for Rosa's experiences are 2 reviews with 2 different perspectives, essentially on the same system. So although we have different legal frameworks for domestic abuse related death reviews, DARDRs, and safeguarding adult reviews, we're looking at the same system, we're looking at the same geography, we're looking at the same person's experiences. And for Rosa, for her, the system is the system, whether it's this NHS trust or that local authority or this domestic abuse service or that safeguarding service. For her, it's a professional face of a system to meet her needs and to protect her from abuse and from neglect. So these reviews, while they're very different and with different methodologies, are united in looking to improve the system within Cumbria and Cumberland so that we're avoiding further experiences like this, so that we're protecting people. And in that sense, the reports are designed to be read together. They're designed to complement each other and hopefully will provide consistent messages about how we can help professionals really meet the needs and protect individuals. And neither of these reviews are blaming reviews. Neither of these reviews are focused on who or what went wrong. These are systems reviews focused on what are the enablers or the barriers to good practice within a system, what influences professionals in their daily work, and how can we make it easier for frontline professionals and individuals working with people at risk. How can we make it easier for good practice to occur, and how can we remove some of the barriers to that? And that's very much the focus of both reviews. So we're going to talk about methodology. And again, because there are different methodologies for domestic abuse related death reviews and for safeguarding adult reviews, the reviews ran slightly differently. So we're going to talk to you a little bit about that in terms of how the reviews took place and what that meant for the learning and the recommendations from Rosa's experience. So Nikki.
Yes, thank you. So this slide just gives a summary overview of the process we went through with the DARDR. So following the decision that a DARDR would take place, which happened quite quickly following the referral in September 23, I was appointed as the chair to oversee this a month later. And over the process of the review, the panel met 7 times, and within that, that would have involved setting the terms of reference for the review, excuse me, deciding what information the review needed to look at, reviewing that information, engaging with family, etc., etc. And the family engagement and the contribution to the review, as I think you might have got the gist of with the initial quotes from the family, was really important and really positive within this in this case. I met with the aunt several times on video calls, which was her preference. She commented on the draft terms of reference. She told me lots and lots of things about Rosa's life and what she knew about their relationship, and was really, her contributions were really critical to the review process. She attended a panel meeting and spoke to all of the panel. and she reviewed the draft report as well. So really critical engagement with the family there. The review was limited in its progression between August and November 2024, and that was because the police had a look at whether it was appropriate to consider any charges against Brian, and that actually came about because of information shared by the aunt. There were actually no charges brought though in the end, so the review continued, and during the review process I obviously connected with the chair of the SAR as well, the Safeguarding Adult Review, and that was really important that we started sharing information, during the course of the review rather than waiting to the end of it. The completed report was presented to the CSP in June 2025 and then signed off by them before being submitted to the Home Office Quality Assurance Panel, who confirmed in 2026 that the report was publishable. So this slide gives you an overview of the sources of information that the DARDR drew upon. So independent management reports were sought from those agencies that it was identified Rosa had notable contact with. Where contact was much more limited or very historical, we sought a short report from those particular agencies. But in addition to the IMRs, there were also the other activities listed there were undertaken, so interviews directly with some police officers involved with the case, which really helped me understand the context within which they responded. Interviews with Rosa's aunt, as I've already mentioned. I did speak to the church's Safeguarding Adults lead and reviewed their safeguarding policy as well, and that was because it became apparent that they had met in the church, and we were kind of a bit concerned about whether there were the opportunity there for Brian to be seeking relationships with vulnerable women through the church, which did bear to have some legs. So also reviewed an IMCA report and minutes of adult social care strategy meetings. Next slide, please. So in terms of the lines of inquiry for the DARDR, I've not listed them all here in detail, but these are the themes that the key lines of inquiry were framed around. So we looked at what evidence there was of domestic abuse, where could we see that evidence and what were the opportunities to disclose domestic abuse, but also what were agencies' responses to that. We looked at what was known about Rosa's increasing lack of engagement with agencies, the reasons for this and the agency responses to it. We considered the use and effectiveness of risk assessments, and also whether Rosa was assessed or should have been assessed as an adult at risk, and also what opportunities there were to identify and manage the risks presented by Brian. We considered whether there were any specific considerations in relation to Rosa or Brian's protected characteristics, so age, disability, including learning disability, gender reassignment, marriage, civil partnership, pregnancy, maternity, race and religion, religion and belief, sex and sexual orientation, and whether, if they were relevant, whether they had had any bearing on access to services or agency responses. We considered the information sharing protocols between agencies and whether they were needed, appropriate and effective in this case. And, as I do with all reviews, kind of looked at the resourcing, policy, procedures and training with agencies to see if they may have impacted on how agencies responded as well. And although it was outside of the lines of inquiry for the review process for the review time frame, we also sought information historically on the removal of Rosa's twins and the circumstances around that, relevant referrals to adult social care, and an overview of Brian's offending history domestic abuse related offending history as well. Over to you, Elliot.
The mute button. So the Safeguarding Adult Review initially started in 2024. So the reviews didn't quite run concurrently. And this was complicated by a change of author. So this was a review that I joined after the previous reviewer could continue working on the review. So I took over the review in 2025, and we got to publication just last month. So what that meant was we had a number of key lines of inquiry, a number of questions that we wanted to ask of the system. So for the Safeguarding Adult Review, we identified a number of areas from the initial information, from some of the DHR information, a number of areas that we could look at. So that allowed us to configure the Safeguarding Adult Review so that we weren't going to duplicate the Domestic Homicide Review, but we're going to cover areas that would complement it. And we'll get on to some of those later. So that allowed us to work around those. I saw the note in the chat around learning disability and learning difficulty. There in the information were some notes to a formal learning disability, but it was very unclear as to the extent and the degree of that. I think from some of the historical information, she'd suffered an accident very young that had resulted in some possible brain damage, some developmental issues. So it was very unclear as to exactly how that impacted on her, but it would have fallen under learning disability rather than difficulty. Anyway, back to the SAR questions. So these were the areas that we looked at through the Safeguarding Adult Review, and this is very much how we structured it. So we looked at some of her personal characteristics. So how did the system more broadly respond to her need for care and support, her particular vulnerabilities, and it's not a favourite word to use, but it describes the dependence that she had on others, and that was the important dynamic. We looked at how systems fit together, especially how safeguarding systems and domestic abuse systems fit together. Do they complement each other? Are they mutually exclusive? Do you tend to go down one route or the other? Or do we put those together and run them in partnership? We looked at enablers and barriers to the assessment of her need and responding to her care and support. Again, looking at what are the challenges that professionals faced meeting and assessing and delivering support for Rosa, and what were some of the challenges within the system itself? What are the things that make your lives more difficult or easier? We looked specifically at the family and the professional interactions, because that played such a big part and was some of the most significant challenges, was being able to work with Rosa directly, navigating the family dynamics and Brian's input and barriers maybe. And then we look also at the legal frameworks. So what frameworks do we have around Rosa's experiences? And there's some of those here: mental capacity frameworks, safeguarding frameworks, domestic abuse legislation, and human rights, among others, criminal justice routes. And how do we bring those systems to bear to protect individuals when so often we're working from a different starting point? The review itself ran slightly differently to the domestic abuse related death review, and that's not uncommon. So maybe less of a panel focus, but we used the qualitative research techniques. So we had a lot of information, especially because we had access to the information that Nikki had gathered for the DHR. So we had a huge amount of information to manage, to organise. There was a significant amount of work that the first SAR reviewer had done, and I had access to some of that, which was really helpful. And we'd already had a number of bits of information provided. So we used those questions to really focus the Safeguarding Adult Review. The SAR questions that I presented, we put to practitioners in the learning event who were really well engaged, very open, very honest about their experiences working within the system. So that gave us some really good perspectives to be able to put together. I've mentioned the DARDR report already, and that range of different perspectives combined with what we know nationally that other areas have also struggled with, and other enablers, other barriers, that allowed us to bring those things hopefully together in 2 reports that provide a real focus on Rosa's experiences and what we can learn from her life and her death in order to improve the systems in which we work. So we're going to talk specifically now about domestic abuse. So I'll hand you back to Nikki.
Thank you, Elliot. So, yeah, thinking about what evidence there was that Rosa was experiencing domestic abuse, actually, when we looked, there was lots. There are numerous incidents recorded of Rosa having injuries that were unexplained or with limited explanation. In 2016 and again in 2017, health professionals noted extensive bruising on Rosa with no explanation noted of how the bruises occurred. And there were 4 occasions between 2020 and 2022 when Rosa had apparently fallen and sustained injuries. And it was noted in relation to one of these incidents that it was difficult to ascertain the history and nature of Rosa's injuries. And Rosa often had bruising and injuries to her arms and legs. Inappropriate manual handling was identified as the cause on some occasions, but there were other occasions when the bruising was not explained or was inconsistent with the injury. So although there's no, none of that is for certain, there clearly are kind of alarm bells ringing there, aren't there, about the physical abuse she may be experiencing. So Rosa and Brian's relationship developed really quickly. It seems that within a year they'd established a relationship, married and had twins, and a fast relationship progression where the abuser seeks early and premature commitment can be a typical feature of coercive control. And although Rosa's family said she absolutely loved her wedding, they did believe that there was some coercion to marry and that the marriage gave Brian more control as Rosa's next of kin. Children's social care hold detailed notes on the supervised contact sessions between Rosa, Brian and their twins in 2014, and they reported that in quite some detail that Brian was observed to be extremely controlling, patronising, abusive and coercive in his behaviours towards Rosa. When it became known to Rosa and Brian that contact was going to be phased out and that they were moving to indirect contact with the twins, Brian started cancelling nearly all contacts after that, which meant that Rosa was being further isolated with no support in her place. And it was of particular concern, although it was a long time ago, that Rosa was in effect just dropped after all that evidence being identified that she was being coercively controlled. Later, it's noted that I think the family told us that Brian led Rosa to believe that the removal of the twins was her fault. So the aim of which was likely to divert responsibility from him and to reinforce a sense of worthlessness in her. Throughout her health records and until she was admitted to hospital, Rosa was documented as having capacity to understand her care and support needs, but it was unclear if decisions were made by Rosa or whether they were indicators of coercive control in relation to things like her not being brought to appointments, not complying with requests for her weight to be recorded, her medication not being collected when it should be, instructions being left by Brian that Rosa was not to be seen on her own by healthcare professionals, and also the use of a third party, quite often in Todd, his nephew, to monitor when Brian wasn't present. And when she was brought to appointments, Brian always being in attendance. In the second year of the cladribine, the medication for MS, she refused to take this in its second year, despite it being in her best interest to do so. And it wasn't clear if this was Rosa's decision or if she was influenced by Brian to make this decision. And then, of course, there was Brian's behaviour when Rosa was admitted to the medical ward and his insistence that he wanted to take her home, despite her being on a doles. And although he didn't actually attempt to remove her, he did threaten to once the doles had expired. And he was sometimes obstructive to care staff and wouldn't always allow access to Rosa without an appointment, and would often answer her mobile phone as well when professionals did call to speak to Rosa. And I think the family highlight how kind of throughout the relationship and particularly since they moved into their own tenancy, Rosa became more and more isolated from family. And even when Rosa was hospitalised and subject to the doles, the family highlighted that Brian continued to control access to her and to isolate her from the family in hospital. So Brian would take all the visit slots that were available, but then unbeknown to the family would not always visit Rosa within those, so that they couldn't then because his name was allocated to them. In relation to economic abuse, in 2023, Rosa's aunt disclosed concerns to a social worker about Brian's behaviour, which included financial coercion and a tight grip on financial matters, extending to Rosa and Todd's finances. Back in 2020, the housing officer raised concern that Brian was not paying the rent despite being given the money to do so. And lack of funds was also often cited as a reason for Rosa not being able to get to hospital appointments, although he should have had the benefits to enable him to do that. And later on, two other occasions, Rosa's aunt raised concerns with the MS nurse about financial control held by Brian, and not just over Rosa, but also over the grandmother and the uncle, as well as Todd. And that Brian would take the grandmother's bank card to pay bills, but then would spend the money in the pub. And Brian largely managed Rosa's communication with DWP around the benefits, claiming to be her carer. I mean, additionally, Rosa's learning difficulty or disability itself may have increased her dependence on Brian to manage finance and a vulnerability to economic abuse, because people with learning disabilities are more likely than other sections of the population to need help managing their finances. Brian had a history of sexual abuse, allegations of sexual abuse towards children, and a previous partner disclosed that he had raped her more than once. And whilst all of these were concluded with no further action, they were enough for children's social care to consider Brian a risk and to be concerned about his contact with children. A complaint made by neighbours in June 2020, so when they were living at the grandmother's house, cited that Brian was using sexually explicit language to a female visitor and then was overheard for verbally abusing Rosa. And then, of course, Rosa was found to have blood-stained incontinence pad despite not having periods for a time due to her contraceptive implant, which may have been an indicator of sexual abuse. And when Rosa was asked who was changing her pads, she pointed to the nephew, Todd. And Rosa was asked if she would like carers to help with this, but responded that they should ask Brian. And on one occasion, Rosa told police and adult social care that she didn't like Todd because he bullies her and that she didn't trust him. So as Elliot mentioned earlier, there were also concerns about and for Todd as well. And in that incident, Todd, Rosa said that Todd, she indicated that he may have hurt her because she used a jabbing movement with her elbow and pointed to her shoulder when asked where he'd done that. But then there was also evidence that Brian was controlling of Todd too. Over to you, Elliot.
So in the Safeguarding Adult Review, one of the things we looked at were some of the big system themes. I suggest, Nikki, we look at the next slide and then maybe take a break at that point. And then we'll come back for learning. But to kind of give you an idea of where we're focusing, the reviews from a systems point of view find some big themes. So intersectionality, by which we're talking about Rosa's gender, her health conditions, her vulnerabilities, her identity characteristics. All of these were able to be used by Brian to coerce, to control, and to abuse. So one of the big themes here is around that intersection of individual characteristics, the perpetrator of abuse and domestic abuse more broadly. We looked at safeguarding and domestic abuse systems, and nationally there I know quite a lot of debate about the fact that they're legislated for separately, that they're strategically managed very often separately. So even at that national level, there's already potential for a fragmentation between systems. That makes it more difficult for practitioners to work together. Barriers to access of lived experience. Well, this is not only Brian putting barriers in place to professionals being able to really hear from Rosa, but some of those broader barriers that we're having, really understanding and hearing an individual's experience. Within that context, of course, we're all working under significant system pressures. Resources, time, demand for health services has never been what it is just now. And under those system pressures, it's very easy for us as professionals to become more rigid and to deal with that turnover of referrals by making quick decisions, and we have to do that. So those don't help when a particular case needs that reflective time spent really immersing yourself in what's happening and reflecting on those experiences. And it becomes more difficult when we're under so much pressure. If you add then the complexity of the family dynamic, the coercive control, disguised compliance, which we'll talk about later, there are lots of things within the family that made it that much more difficult for professionals to really get an idea of what was happening. And then I've already alluded to some of those challenges in the different legal frameworks and the complexity of working in some of these situations. So what we've hoped to do is provide you with a kind of broad view of Rosa's experiences, a little bit about who she was, and the systems and the review processes that were in place after she died. We're going to take a coffee break now, and then when we return, we'll look in more detail about the lessons learned and the findings of the reviews and what that means for our culture and practice.
Okay, welcome back everybody. So I'm now going to, or we are now going to take you through some of the lessons learned and findings from the 2 reviews. We're not going to present the recommendations because you can easily check them out yourself within the reports. And we're going to talk about these across kind of 3 broad themes. The first is identifying and responding to domestic abuse, then appropriate assessment, care and support for Rosa, and then responding to risks posed by Brian. And I'm going to first present the key findings from the DARDR, and then Elliot will then kind of add value to that by talking more broadly about what additional or broader kind of lessons were learned within the SAR, so really padding that out. And then finally, just kind of acknowledging some good practice, because it's important to do that as well. So if we could go to the first slide, please, Elliot. Thank you. So the first theme was around identifying and responding to domestic abuse. As a woman with a learning disability, Rosa was statistically at particular risk of abuse, and the multiple sources for intelligence suggest that she was abused at home, although to what extent is unknown. Due to her learning disability, her level of comprehension would have influenced her capacity to understand that she was experiencing domestic abuse, or to identify or understand the risks that meant for her. Specialist advocacy over a period of time, and with a trusted professional, and utilising information and tools appropriate to her levels of understanding, might have assisted her to relate and articulate her experiences better. The police responded to 2 reports, direct reports of coercive and controlling behaviour from Brian towards Rosa. One report prior to the review time frame was closed after speaking to Rosa due to no evidence of harm or abuse being identified. The latter, in August 2023, resulted in a visit to Rosa in hospital by a uniformed officer. Rosa didn't want to talk to them and kept avoiding eye contact and looking out of the window. But when you think about the context within which the visit took place, so it took place early evening, and the body-worn video shows Rosa lying in a bed while officers stood in their uniform and used long descriptive sentences to explain the reason for their attendance. And when you think back to Rosa's aunt's comment that she had the comprehension of around an 8-year-old, this must have been especially confusing and scary for Rosa. So there'd been no preconsideration of Rosa's needs in relation to this visit, or in the relation to the visit back in prior to the review timeframe, which was a one-off, and didn't take account of any of the circumstances or around it or Brian's history. When a subsequent visit was made by an officer in plain clothes and with a social worker, which was an improved response, Rosa did. This is when she did appear to make a direct disclosure about physical abuse from Todd, when she was reported as saying he bullied her, and made a jabbing movement with her arm pointing to her shoulder when asked about that. But when the DS reviewed this, and in conversation with the PC, it was then determined that no offences were disclosed, and that the elbow comment was more of a jovial, probably more jovial than an assault, and that Rosa was wanting to go home with Brian and Todd. And the panel really did agree that that wasn't a fair assessment of what Rosa may have been trying to communicate, and that the police response was concerningly dismissive of this. The DS should have further reviewed the incident log and other information to make a more informed decision, but they didn't. Also, in arriving at a decision that no crime was apparent, the DS had not considered Brian's past history, did not consider talking to family members or Brian or Todd to gather more information, nor would they consider the possibility of a Section 44 offence, so offence for a person to ill-treat or neglect a person who lacks mental capacity, which at the point they visited her in hospital, she had the dolls in place. Police responded twice to requests for DVDS or Domestic Violence Disclosure Scheme, or Clare's Law disclosure. So that's the one where they're able to tell a new partner or current partner about their partner's abusive past, domestic abuse related offending past. They first attempted to deliver this to Rosa in September 2020, but she declined to hear the disclosure stating she was happy in a relationship and had no concerns. But again, there was no reflection on how best to approach Rosa or how her reactions may be influenced by Brian's control, and there was no intermediary at all used to communicate with her. And on speaking to the officers involved, it became apparent that at that time, the visiting officer would have been required to wear a mask due to COVID, and the practice would have been to remain standing at visits to minimise COVID-related risks. So that must have only heightened the confusion, intimidation and anxiety related to the situation for Rosa, particularly given her expressed fear of COVID, but also made clear and supportive communication really difficult. And the second request for a DVDS was in the August 2023, when it was decided that adult social care would need to establish if Rosa had capacity before that could be considered. The panel had some discussion about the kind of multi-agency opportunities to bring together responses and how effective they were, and actually realised that the MARAC really could have provided a forum for a multi-agency response, but it would be essential that this was equipped with the knowledge and understanding around learning disability and domestic abuse, and that the interface with safeguarding inquiries would be clear. But a multi-agency response in any setting might have also benefited from expert domestic abuse input. Over to you.
So I think here is where it becomes so important to recognise the different strengths and the different challenges within safeguarding systems or domestic abuse systems, and that actually for individuals with disabilities, in Rosa's case, chronic health condition, learning disability, capacity issues at times, that the two systems really need to work together. Looking at the national data and looking at statistics around disability and domestic abuse, there are estimates that 13% of individuals over the age of 16 with a disability are victims of domestic abuse, and that's significantly higher than a population rate for individuals who don't have a disability. That's a national statistic. If we look locally in Cumbria, so in the year before Rosa's experiences, 21,500 adults experienced domestic abuse, and of those, it's estimated that around 5,000 had a disability or were a disabled person. So that's 23% of individuals that experienced domestic abuse also had a disability. When we think about that in context, and when we hear about Rosa's experiences of services attempting to work with her around domestic abuse, we need to look at the system's impact on that. So considering it from Rosa's perspective first, that disability, social isolation that we saw earlier, engineered by Brian in lots of ways, the fact that there is already a higher risk the fact that Brian had a pattern of behaviour of targeting or preying on women with additional needs, with learning disability or disabilities. Given her mobility needs, the estrangement from family, and her dependence on Brian for practical support, for care, for treatment, for access to medical services, that shows that pattern of perpetrators exploiting disabilities as a way of exerting more control, acting as a barrier to access to services and engineering that social isolation. So these factors already are an amplifier of risk, and we know that nationally. And that's one of the big, for me, one of the big messages from the DHR, the DARDR, and the Safeguarding Adult Review is that for individuals who have a disability and an experience of domestic abuse, they are that much more at risk and need a greater level of sophistication in the response and approach, as we've heard from Nikki. So in that context, domestic abuse is a type of abuse in statutory guidance. It's not very well drafted, and it's now slightly out of date because of the Domestic Abuse Act. So that's one area already that makes it more difficult for professionals, is the definition and the description of domestic abuse in the care and support guidance is not significantly, but it is materially different to that in the Domestic Abuse Act. So it's not a surprise that nationally and locally many practitioners are uncertain or identify inconsistencies in how those systems come together, in how Rosa could have been supported in domestic abuse interventions via police or social workers, or the Clare's Law disclosure, the DVDS disclosure. These things needed to be done with the sophistication that safeguarding can add. Those two systems working hand in hand together. But there are challenges, and we know there are challenges, and the reviews identify some of those challenges in being able to be explicit about what domestic abuse is, in navigating different referral systems, parallel procedures, if you like, coordinating safeguarding inquiries with the MARAC and domestic abuse systems. These are the things that make practice more difficult. So yes, there were failings within certain agencies. There were decisions that could have been made differently. Behind that are different statutory definitions, different governance arrangements, different culture and practice. So we can look at changing some of those systems. What it means for frontline practitioners is that we have systemic barriers to overcome. Not only the challenges presented by Brian, not only the vulnerabilities that Rosa had, but also that we have different systems, but each of us has different expertise in those systems. There are experts in the domestic abuse system that could rely on colleagues from safeguarding to help get that sophisticated response. And there are individuals within safeguarding systems who can draw upon the expertise within domestic abuse systems. And if we work together and if we come together, then we can address and we can overcome some of those structural challenges that make our practice and good practice more difficult to achieve. So one of the reasons we wanted to do the learning event here today, and one of the reasons why we're presenting it in this way, is that we can then highlight the needs of individuals who experience domestic abuse, who also have a disability or health conditions that affects the decision making or their level of dependence on others. And for those individuals, we need a better response to address that heightened risk. So, Nikki.
Thank you, Elliot. So the next theme was around the appropriate assessment, care and support for Rosa. And as I previously mentioned, we were very much looking at this through the lens of, you know, how these may have impacted on the opportunities to identify and respond to domestic abuse. So when Rosa was diagnosed with MS, this was viewed as her primary need, and her learning disability was the secondary need. So Rosa had been supported by the Adult Social Care Learning Disability team, but after being diagnosed with MS, her care and support was reviewed by a different social work team, and that later impacted on how agencies prepared for or interacted with Rosa, and the kind of lack of attention that was given to the fact that she had a learning disability, and this really significantly impacted on how she understood and responded to things. So Rosa not attending medical appointments should have been a red flag. Rosa would never give an answer as to why she was missing health appointments. And if Brian was there when she was asked, he would speak for her and said that the reasons were because of financial difficulties, which prevented Rosa being able to afford to get to travel to appointments. But collectively, there were many red flags, including a potential, indicating a potential high risk situation. But the lack of a coordinated response to these hampered an effective multi-agency risk management plan. And again, I reiterate that this could have been facilitated by a MAWAC referral, and within that MAWAC having the required expertise had that occurred. Rosa was referred for a Care Act assessment on a number of occasions, and this would have provided the opportunity to gain a fuller picture of her needs from the point of view of all those involved in the assessment process and the individual personal outcomes in relation to the 9 areas of wellbeing. There was a delay in allocating a social worker to complete a care assessment, and I think that a care assessment was never undertaken with Rosa. There is a significant gap. Police officers placed in safeguarding roles were not really prepared for that particular role and the responsibility they had been handed. The DS, who concluded that no crime had been committed when a report was made about possible abuse towards Rosa, and when Rosa was interviewed, acknowledged that he'd been placed in an acting DS as an acting DS in a safeguarding role, but wasn't given any specific training to support this. The police officer who visited Rosa in hospital with the social worker was also a safeguarding officer, but noted there'd been little preparation for this role or CPD opportunities to support this role. And all of the officers spoke to about their response were unaware of the potential advocacy roles that may have been able to help support their engagement with Rosa. And this suggests a real gap in the training of officers expected to respond to safeguarding concerns and related crimes within their roles. And Rosa's family were critical stakeholders. They knew what was going on. They were aware of the risks she faced. They didn't know what to do about it. They made attempts to do something about it, and they should have been seen as key stakeholders in the planning of responses to her. Over to you, Elliot.
Just think about what are some of the reasons that it was so difficult to manage Rosa's needs or provide a service for that, or even assess. One of the things that I think was at play are the limitations we face day in, day out. There are also opportunities. Providing an assessment of health and social care needs necessarily is a relational interaction. We can get so far on paper before we need to talk and listen and hear the experiences, the day-to-day experiences of service users and their family members. Even the simplest treatment or intervention still involves a process of transaction, and I use that word quite carefully. There's the offer and hopefully the acceptance of a health or social care intervention based upon assessment, best evidence, negotiation, dialogue and consent. No longer do patients visit a doctor who says, yeah, well, just take this tablet, off you go. And the patient willingly goes away and complies without any real understanding of what's happening. Practice now is far more sophisticated. It's a partnership. It's a whole dialogue. So let's think about Rosa. In her experiences, there were often family members communicating on her behalf, declining interventions on her behalf. And Rosa, when she was able to have a voice, may often say, oh, well, talk to Brian, he knows best, he knows, talk to him, it depends on what he wants. And we'll defer to others. Those red flags were difficult to see at times. So the views of Brian and to a certain extent Todd became a substitute for Rosa's own views, despite concerns around coercion and control. Rosa's choices, her voice, the risks, her day-to-day experiences were all filtered through Brian and through his interpretation and his views. One of the real challenges in addressing that, because we're using a huge dose of hindsight now, because we can look back and we can see that pattern so clearly. But at that moment, stood at that front door, trying to get to see Rosa, with Brian very plausibly saying, oh yeah, no, it's okay, we're doing everything that's been advised, and we're going to go and see the GP, and we're going to get the medication, we're going to provide this care, and don't worry, we've got everything we need, we're doing everything you ask of us. That appearance of concordance and compliance, and that engagement with professionals by Brian and Todd was designed to deter further involvement. When Rosa's in the background, oh yeah, no, Brian knows what I need. And when Brian is there agreeing and engaging very positively with professionals at times, not always, but when that process is happening, it's very difficult to ask those questions, to push and push and push. So what we're hoping to achieve through these reviews is really highlight that issue of disguised compliance, and that often we need to be really curious. And there's that concept of professional curiosity, which is so often misused to say, oh, well, a failure of professional curiosity is a failure of the professional to see what was right in front of their nose. And that's not really the case. Professional curiosity is about really desiring to know what's happening for somebody, to triangulate through multi-agency systems, to go beyond what's being said and beyond what just assuming that you take information at face value. It's knowing when to be skeptical, in old parlance, when to think the unthinkable. But this isn't a judgment of the professional. This is about a culture of curiosity. This is about overcoming disguised compliance and being able to recognize it. One professional by themselves is very unlikely to be able to do that. This is where that multi-agency practice comes in, being able to say, oh, actually, I found that too. Or reflecting together on behaviors to be able to say, actually, I think there might be another story here. That's what we're hoping for. Striving for professional curiosity, not getting beaten down by it. And there are lots of really good resources in Cumbria around professional curiosity and the barriers to taking action, the things that get in the way of us being able to see what's happening. It's very rarely actually about the professional or their standard of practice or the quality of assessment skills. It's more often about those other barriers around. So Nikki, back to you.
Thank you. And I think Simone has just put a link in the chat to the resources on professional curiosity, which is really helpful. So the third theme was around responding to the risks posed by Brian, and it was really important to focus on him as well, because often the perpetrators can be quite invisible. But actually, Brian had a significant history of allegations of abuse towards vulnerable adults and children, and as far back as 2009, a children's social care group meeting identified that he establishes relationships with women who have some level of learning disability or are deemed to be vulnerable. And there's an extensive history of allegations of domestic abuse from Brian towards previous partners, documented, as I've said before. And again, in 2014, Children's Social Care directly documented concerns in some detail about Brian's controlling behaviour towards Rosa. Despite all this, Brian's forensic history doesn't appear to have formed any part in the decision-making and risk assessment. Police just seem to accept that Rosa did not make disclosures. Opportunities to record and investigate crimes were missed. And so Brian was never ever a domestic abuse suspect in a criminal investigation relating to Rosa. He was never interviewed while under arrest or as a voluntary interview. And overall, the police appeared to have been assuming that adult social care involvement dissolved them of needing to investigate a potential crime further. And Brian was still exerting control over Rosa while she was in hospital, despite all of these, growing and everybody knowing these concerns. The impunity continued for him while she was in hospital, where he was present despite the identified concerns and continued to control the family access to Rosa. So there was something there about thinking about how the family made some quite helpful contributions to the discussion around this, around how they understood what Rosa wanted, or what was best for Rosa, if you like, and what, given the dolls, and also what the visiting arrangements are, and kind of how they can be abused and misused. Brian wasn't given a carer's assessment. He'd taken on the role of the carer, and agencies interacted with him regarding the care and support needs of Rosa and were prepared for him to speak for Rosa, but he'd not been given a carer's assessment. And this was a real missed opportunity, not only to ensure that his own needs as a carer were met, but critically to ensure that assess that the care he was providing for Rosa was appropriate and safe. I'm going to go back to Elliot.
So let's think a bit more about Brian and his role as an alleged perpetrator. There's immediately an issue around language here. And within a lot of our systems, we're often looking at thresholds for suspicion. So we know in safeguarding that we're often on a balance of probability. We're very rarely hitting that criminal justice system threshold of the 85% beyond reasonable doubt. So the language we use is often moderated. The person alleged to have caused harm, a source of risk, a perpetrator of abuse is another step, and we tend to reserve perpetrators' terminology for individuals that have convictions. But when people don't have a conviction, or when individuals aren't identified as perpetrators, but suspected or alleged individuals who may be causing harm, then we're already on a bit of a back foot. So one of the areas that I think is being recognised more and more is this issue around tackling those individuals who may cause harm. Perpetrators is the word we're going to use through this session, albeit I'm aware that's often a word we veer away from. And the reason is this: anyone at risk of domestic abuse is entitled to the protections of the law. But there are challenges. There are challenges in delivering both protection to victims, but also justice to those perpetrators. So legal frameworks, especially around safeguarding children, safeguarding adults, and to an extent domestic abuse, are very victim focused. And of course they should be. We should be empowering individuals to have more control over their day-to-day experiences. We should be protecting a victim's right to autonomy and self-determination, even within and especially within their relationships, to be able to choose relationships of safety, not those where they're going to be exploited and abused. But those systems that we have, those frameworks for safeguarding, have very limited powers to address or tackle perpetrators of abuse, to track patterns of risk. Many safeguarding inquiries, and all safeguarding inquiries should be in line with the principle of making safeguarding personal, person-centered, outcome-led, or the other way around. Those safeguarding inquiries don't have any specific powers around disrupting perpetrators of abuse or tackling those. We add those by bringing other legal frameworks to bear. We add those through our professional expertise, our multi-agency work. We often rely on criminal justice organisations, police, probation, and others. A combination of frameworks is therefore needed. We can't just rely on the legal frameworks we're most familiar with. And this is another area where some of the expertise issues are barriers to practice. As a community nurse or even a social worker or others working within the system, you cannot be an expert on every piece of law that may apply in a complex situation. We need to be able to bring together all our frameworks so we can consider how we can tackle the perpetration. So Nikki earlier mentioned the Section 44 offence, that's Section 44 of the Mental Capacity Act. There is a similar offence, incidentally, in the Mental Health Act, but the Section 44 in the Mental Capacity Act is about the willful neglect or ill treatment of an adult with less capacity. It is quite a poorly drafted offence, if I'm able to say that. It's the way that you bring a case under Section 44 can make it very challenging to gather the evidence that you need. It can be very, very difficult, even if you're aware of that offence, and even if you're minded to and inclined to pursue a conviction under that offence, it can be very difficult to build a case that sticks, that achieves a conviction. And again, looking at the national data, the numbers of convictions under Section 44 have been falling since it was introduced. And that's just one example of offences that exist that we may not know very well, or even if we do, it's difficult to achieve. And the statutory guidance to the Domestic Abuse Act 21 introduced an idea of perpetrator panels and specific powers to be able to track and disrupt and manage and tackle perpetrators of abuse. But there's no real national consistency in those. They're different in different areas, they're resourced differently. Some areas have put a lot of resources into tackling perpetrators, others not so much if you look at the national picture. So dealing and tackling with perpetrators is an area, and I think a gap at that systemic level. I think that was all I was going to say about that, but it's the finding from both of these, and certainly from the Safeguarding Adult Review, that we need to be much better at bringing our legal processes together and our safeguarding and domestic abuse processes together in order to tackle perpetrators of abuse and to learn from the experiences of individuals. And for those individuals that are struggling to be autonomous within their relationships, it's some of our role to provide the environment and the circumstances in which individuals can be more autonomous about their experiences and what's happening for them. And that's one of the biggest challenges I think we ever face. So back to you, Nikki, to look at some of the good practice identified within the reviews.
Sure, thank you. We've talked a lot about kind of what went wrong, and I just wanted to highlight some of the examples of good practice that were identified during the course of the review. And while some of these were not necessarily available prior to Rosa's death, they did offer the panel some reassurance that responses had improved in some areas since Rosa's death. So Riverside Housing made a referral to adult social care when neighbours raised concerns. And the reason we kind of identified that as particularly good practice was because it could have been so easy for a housing provider just to see it as a minor incident of antisocial behaviour, but they recognised that there were vulnerable adults involved, that that Brian's behaviour was particularly concerning, and they made that referral. And whilst they didn't always achieve the desired outcome, the MS nurse really did show real determination in making multiple referrals and knocking on lots of people's doors in her attempts to make Rosa safer. And actually the work that did take place on a multi-agency basis, and the interaction Rosa did have with different professionals often came as a result of the determination of the MS nurse. So it's a thing about kind of going above and beyond a bit, isn't it? And with knowing that something isn't right and just kind of like not giving up on it. We identified that the GP had developed a pop-up on their electronic patient recording system for all patients who were on the learning disability, so that they would instantly know that they would need to consider reasonable adjustments, and whether the patient had capacity to make decisions about their treatment plan or needed support with that process, which we thought was a really positive thing. In 2023, the North East and Cumbria Learning Disability Network launched the Prevention of Adult Not Brought strategy. So that's about missed appointments and reasonable adjustment campaign. And two toolkits were made available for primary and secondary care. And alongside the toolkits, there were education packages, excuse me, a risk concern tool, prevention of adult not brought flowchart, and top tips resources as supporting resources. So that was really positive. And the reasonable adjustment campaign was a series of posters developed for healthcare professionals, social care professionals, and people with learning disability and their families. And the aim of these was to raise awareness of people's rights and legal obligations to provide reasonable adjustments and to understand what they are. So I think that's us. I guess before we make any kind of final concluding comments, I'm wondering if there are any questions in the chat that we need to respond to at all.
Thank you.
Simone.
Thank you both. Yes, there are a couple of comments in the chat, but indeed they are just comments, and I think Mary Claire's responded to some of those. However, there is a question from Amanda Boardman asking, is the learning from this review being used to inform or shape the DRIVE project in Cumbria? I can't answer that, but I don't know if Mary Claire's able to answer that.
Yeah, hi Simone, I've just put a comment in. So yeah, Mandy, I mean, this comes into the perpetrator response within this review and other reviews that we've published, and some that are still in the Home Office kind of system. Look at the response of perpetrators, they look at the kind of, you know, the perpetrator being the voice of the victim in a lot of cases, you know, information not sense checked, and not kind of having that routine inquiry, I guess. So giving the victim a space for action without the perpetrator being there. So yes, certainly within the DRIVE steering group, the thematics of this and other reviews are absolutely taken into consideration.
I suppose my only concern, Mary Claire, is that if this case hadn't met the threshold for MARAC, would it have still been considered for DRIVE? So it's maybe just something that we need to think about when we're shaping that kind of DRIVE project going forward.
Yeah, I mean, certainly it definitely wouldn't have met threshold based on what we knew at the time. I think this is, again, thematic of a lot of DARDRs, where a lot of people have a little bit of information. That information isn't kind of collated, doesn't come together as kind of a multi-agency response. What we've made sure that we've done following this review is that kind of case management systems are marked up, because we heard right at the beginning that, you know, there was a, you know, he targeted people who had those similar difficulties. So we need to make sure that moving forward, if that happens again, that this is all kind of, you know, logged on people's systems. Had we had everything added together, absolutely would have met the criteria for DRIVE, but based on single agency information, it wouldn't have done at the time, no.
Yeah.
Thank you. So looking through the chat and some of those comments, there's a couple of things I'd probably add on to that discussion just there. So going back to some of the comments about thresholds, both between the statutory and voluntary sector, third sector, but also between systems. I think there's always going to be a need for referrals to be assessed and considered against a threshold, in terms of just how overwhelmed different parts of our system are. There's a need to be able to prioritise and to target the resources where they're going to have the most impact. That said, what we've looked at with Rosa's experience is one of those factors in making decisions about referrals, one of those factors in thinking about whether to accept and work together or whether to signpost, is going to be about the risks and the vulnerabilities. So going back to the beginning, we were talking about the incidence and the prevalence of domestic abuse for people who are disabled, and the additional risks and the additional careful thought and practice that's needed. One of the things we could easily say as well, of course, we should always then just have safeguarding and domestic abuse hand in hand. We should always have both processes in place. That's not realistic. But also we have to recognise that for those complicated cases, and I think there was also mention around how much substance use can increase risk. For those cases where you've got that amplification of risk, neither one system by itself is ever going to be capable of addressing the risk in the way that it needs to be addressed. There are always going to be those cases that just have those extra complexities where that multi-agency work is needed, where maybe there needs to be a MARAC and a statutory inquiry under Section 42 running together and working together and bringing expertise together with all that legal knowledge. The challenge is knowing when and which cases need that level of intervention. So yes, those are really challenging situations to be in, and challenging, especially as the voluntary sector working with a level of risk. Those who are closest to it tend to see it more clearly. So there needs to be a way of bringing those systems together. And that's one of our hopes from this. And then I think thank you, Daniel, for raising just that last comment around support when children were removed. The reviews, I think that didn't come up so much. It was a little outside the scope because of when that happened. But it's a really challenging area. That trauma and the support that's offered is often very child focused, of course, but it doesn't always lead to the sort of support you'd want afterwards, especially if domestic abuse is one of the reasons for a child protection inquiry. And there's going to be that extra.
And just to be clear about that, she wasn't offered any support at all when her children were taken, which is just, you know, quite shocking now when you think about it. I think it wasn't that unusual at that point, but or there wasn't the kind of services. I think the review process was able to identify what might happen now, which would be different. But she wasn't offered any support, and in effect was just kind of dropped and left with the abusive partner,
which pushed her more towards him,
of course,
and left her so much more vulnerable to his manipulation around that. And then the other thing you mentioned was around Clare's Law, and I think it's worth just clarifying the domestic violence disclosure scheme when we talk about the DVDS is Clare's Law, I think, isn't it, Nikki, in lots of ways. So you have the disclosure scheme that both allows potential individuals to come forward and ask about partners that they're with, but it also provides a scheme for a proactive disclosure to potential victims about perpetrators. Nikki, I don't know if you want to clarify that a little bit further.
Yes, of course. And I think probably what Daniel's asking is, you know, was there an opportunity for the family to be informed of Brian's history and the potential risks? And no, I don't think they were, not, as far as I know, offered that opportunity. It was very much focused on Rosa.
So we're nearly at time, and thank you everybody for contributing and for being part of the session. I'd like to close with the final two paragraphs of the aunt's contribution to the Safeguarding Adult Review. And this is very her ask of us as a system. If there is one thing we ask of those who read these reviews, it's that they remember Rosa when they meet someone else whose circumstances are complicated, whose voice is difficult to hear, or whose needs do not fit neatly within existing systems. Her legacy will be found in professionals choosing to communicate in ways that are genuinely understood, looking deeper, listening longer, asking one more question, following through on known risks, and acting when something does not feel right. While we cannot change Rosa's experience, we hope the learning from her life helps create a future in which vulnerability triggers protection, dependence prompts greater scrutiny, and safeguarding systems adapt to the individual. If Rosa's story helps even one vulnerable person to be seen, to be heard, to be understood and protected, then her legacy will endure far beyond these pages. Thank you.
Thank you. And I was really pleased to see the comment in the chat about kind of acknowledging some of today's content might have been difficult, and would reiterate that please do make sure that you take some time for yourself and access support if you need to after this session. But thank you all for giving us the time.